Good afternoon, everyone. We're going to go ahead and get started for our webinar today on creating a trauma-informed environment. Just before we get started, we wanted to go over the continuing education slide here. So if you want to get CEUs, that's available through NYU Silver CE online portal, and you can see the link there. And you just follow the directions to log on and select today's webinar, click register, and then fill in the billing information. We'll be having another slide at the end with additional information as well. So my name is Elizabeth Meeker, and I'm going to be hosting our webinar today with my two colleagues, Gwen Olton and Cheryl Martin, who you'll be seeing in just a moment. So we're really excited to have this second webinar in our six-part series. So last month we introduced kind of what trauma is and trauma-informed care is as an overview, and in the next 5 webinars we're really going to be drilling down into more specifics. And so today we're going to be focusing on creating a trauma-informed environment. And so we're really excited about this because this really is the foundation to creating both physical and psychological safety for the people that we're working with, and as well as for staff in the workplace. And it really lays the groundwork for all the work that we do, because without safety it's very difficult to engage and then to engage in treatment. So this webinar will help us to consider both what we can do universally for all individuals, as well as what we might need to consider and be flexible to meet the needs of each individual that we're working with. So if we go to the next slide, please. So we would like to hear from you first and find out what's important to you about physical safety and kind of your interest in today's webinar. So please feel free to write to us in the chat box so we can hear from you, and we'll be sharing some of the comments we receive. So we'll just give everyone just another minute as they kind of maybe reflect on what's important to them about physical safety, and feel free to share. We'd like to kind of have this be as interactive as possible as a webinar can be. So I think what we'll do is we can kind of move on, but as we have kind of this discussion, as things come to mind, please feel free to enter your thoughts in the chat box, and we can kind of reflect on those as we go through the webinar.
Okay, so this is Gwen Olton speaking, and I'm here with Cheryl Martin. If you were on our last call, you've already met us. So we're here today. We're going to talk about a few things, the environment that we work on and work in. And when we think about the environment and having a trauma-informed environment, we're really thinking about what's the physical environment, what's the psychological, emotional environment that we're working in, what kind of culture are we creating. These are all questions that are pretty relevant to the general principle of safety in trauma-informed care.
No, I think we asked that question up front because how we think about this and how we've experienced things in our life really has a lot to do with what we have as expectations around safety, both physically and psychologically. So we really wanted folks to start thinking about, what do I think about this? What matters to me? And what would I like to see in my environment? And what do I want to bring to the people I serve? So hopefully that thought process has kind of started for you.
Yeah, and so to that end, I'll just kind of briefly run through our objectives. So the first one would be, we'd like by the end of this session for anyone participating to be able to relate one's interpretations of safety to knowledge about our physiological fear responses. So we touched on that a little bit in our first webinar. We're going to touch on that again today. To be able to explain the differences in individuals' understanding of safety, describe concepts of safety to and safety from, contrast and compare proactive and reactive approaches to safety, and to recognize differences in psychologically safe versus unsafe conversational styles. Anything to add? All right. So we'll jump in. Thinking about, we just want to offer a couple of frameworks to think about safety. And, you know, certainly there's more out there than what we'll touch on today. But when I think about safety, I like to think about it in the same way that maybe you were introduced to this concept in school, you know, in thinking about, like in American history, if you were talking about liberty or freedom, one way that it's presented is that folks might have freedom to do things or freedom from barriers to being free or having full access to choices. So in the same sort of way, we want to think about safety. We have safety to carry out our life activities as we'd like to, and we might have safety from being impeded to do those things. Mm-hmm. So what would some of these things be? So we might have safety to choose.
Yeah, and sometimes we don't always recognize we have that safety to choose, and I think that's a big thing to think about as we go through this.
Yeah, so you know, considering, do we feel safe to choose whether or not we want a service? Do we feel safe to choose who provides the service? Do we feel safe to choose, what are some other examples?
Well, what we want to take on. I remember you telling me a story, Gwen, about working in a doctor's office and doctors saying, well, here, I've got Gwen coming in the room. She's going to help you quit smoking. And understanding what you truly have control over and you don't, and not allowing that kind of imposition on what you can do to happen, to say, I can't stop that. I'm certainly willing, though, to work with this person. So we can choose not to take on a responsibility for something we can't do, but hold on to the parts we can do. So I think that's really important.
Yeah, and much more to come on that notion of responsibility that Cheryl mentioned, because it can become pretty important when we think about psychological safety, especially, well, for both service recipients and providers.
Right, and I do see that a lot with folks. That's one of the things that leads to our own burnout and that kind of compassion fatigue when we've taken on things that others have tried to give us.
Spoiler alerts for future slides here. Okay, so we also have safety to authentically express ourselves. So this is sort of a big umbrella that can account for lots of things. So do I feel safe to speak my primary language when I'm receiving services? Am I safe to practice my cultural or religious background practices? So those are some of the things. And here we want to think about, are people really genuinely safe to do these things? So we might say, yes, we'll get you a translator, but if there's a lot of eye rolling, or you're having a tone in your voice or facial expression that's communicating to the person, I really don't want to help you get an interpreter because it's a pain for me, then that person isn't really safe to participate the way that they would like to and to authentically express themselves.
Or if the interpreter is the person that's abusing you because it's a family member, which happens sometimes too. So we can't assume. It is something we have to find out from the person we're serving, what will help you be in that safe place. Does that mean you say whatever you want, Gwen? What does authentically express yourself mean?
Yeah, so I think speaking honestly does not mean that we're not speaking respectfully or being kind and compassionate with one another.
Okay,
yep.
Good.
So, and then we go to the other side, thinking about safety from. So we'd like both service recipients and deliverers to be safe from violence, right? Safe from oppression, safe from coercion.
Absolutely.
Yeah, so we, you know, I think looking at that last point, safe from coercion, it can be very similar to being safe to choose something. So if you are a service provider, frequently there's a power dynamic that even if you're not feeling it very strongly or don't think it's there, that's how many people interpret services when they're accessing them. So if I'm a nurse working in a doctor's office, for instance, even though I may not feel like I have a whole lot of power in a relationship with someone who's coming in the door to get services, to that person, I may have a lot of power. I have knowledge, I have different access to the doctor, I may represent all sorts of things for the other person that feels like a big power differential. And when there is a difference in power and someone thinks that you have power over them versus power with them, they frequently do not feel safe to say no to you or to choose how or when they're going to receive services. So something that a facilitator once told me that I thought was really powerful was, if someone doesn't have the power to say no to you, you can't trust what their yes means. So I don't know what your yes means if you're not actually safe to say no to what I'm saying. So it's just something to keep in mind.
And this is so important and basic to all of this, because when we aren't safe, we're in constant arousal. And when we're in constant arousal, there is more likely to be violence in our space. So this is where it feeds on itself. Finding that place of safety is so important, because it actually makes it safer for us because of not being in that constant arousal and the people around us.
So another framework that we can look at safety is thinking about planning for safety either proactively or reactively, and thinking about how do we have a proactive framework, how do we have a proactive approach for dealing with safety. So you probably have some ideas about this already. You've probably thought about, one example that I heard when I was working in behavioral health for a long time was proactive aggression versus reactive aggression, right? So if you're familiar with those terms, you may already have some ideas of where we're going with proactive versus reactive. So proactive, you're looking at this bigger picture, you're looking at how do I create safety across time for the longevity of the organization, how do I create sustainable safety. So in a proactive approach, you're really going to anticipate concerns. You're going to think ahead, what are some of the possible outcomes that could be troublesome to folks, and to that end, you're able to involve all stakeholders. So if you're not doing this in an anxious moment where safety is a concern, you're able to really consider, who are all the people that should be at this table with me? Who are all the people that I should be considering? And we would say, if you're on the fence about it, include them.
Include them, right, because we know this is a continuum, and people sit in all different places around the feeling of safety. And without everybody, how are we going to know that? We're either going to go all the way down here or all the way down here and miss what we really need to be finding. So,
yeah. So we're able to work with varying expectations in a proactive approach. So some people may have a different view of what's safe versus, and they may even be in conflict sometimes. So my strategy for safety may not be Cheryl's strategy for safety. If we're proactively planning, it doesn't mean that everybody gets what they want, but we may be able to make sure everyone gets what they need. And it's much easier to do that in a proactive approach.
Yeah, everybody's voice being heard is important. In that, it allows some more safety for individuals, because, hey, this group is listening to me. They may not be able to make it perfect, but they are listening to me and they know how I feel.
And with this approach, you're less likely to negatively impact someone's sense of autonomy. So we find that if you are planning for safety in a moment of reactivity, or you're planning for safety when a crisis has happened, it can be likely that people's autonomy may suffer, or their sense of autonomy may suffer. So we'll frequently choose safety over autonomy or over freedom to choose, but those don't actually have to be mutually exclusive if we're mindful about our planning.
Right. I think about that older adult person, because I'm one of those, and just that idea of how safe do you want me to be. If it means you're going to tie me in a chair and I can't get up and I can't be independent and I can't do what I want, to me that's not even tolerable. So it's those kinds of things we really have to think through, balancing that risk with the safety and understanding that each person is going to be different and what they're willing to have as risk.
Right. So then what would the reactive approaches entail? So these are approaches that deal with concerns on an ad hoc basis. So you deal with a safety concern as it comes up. And to some extent, probably every organization does this a little bit, or every person may do this. There are just some things that, you know, they don't occur to you to plan for, or it doesn't occur to you that it might pop up despite best thinking and best effort being put in. So sometimes it just happens that something happens and then you have to plan for it.
And there's pressure within systems, when we're honest about this, to do something when something happens, right? There's pressure. And sometimes that something that we do goes way beyond perhaps what's necessary or even helpful, because people feel the need to do something. I think that really emphasizes how important it is for us to do the proactive thing and to really understand what we have control over and what we don't.
And it can be the case, right, that some of the methods of dealing with something on this ad hoc basis, so when something comes up and then we deal with it and maybe there is pressure, it doesn't necessarily mean it's a bad response or not a worthwhile response, right? It's just something to consider in the same way that we don't necessarily, like myself as an individual, I don't make my best choices and my most thought out choices when I'm operating from my reptilian brain, right? So if I'm really triggered and activated and nervous and worried about safety, it's not the best time for me to plan my vacation, for instance, or to plan how I want to have a difficult conversation with someone, because I just don't have great access to my prefrontal cortex. I don't have great access to the planning and thinking parts of my brain. And systems work similarly. When we're all reacting from this really anxious place, we don't do our best planning, we don't do our best work.
We do the immediate things we need to do to make the safety for right now, and then take it away from there to think about it once our prefrontal cortex is working effectively, to be able to sit down and really think this through in a realistic way that balances that risk and safety.
So it's good for us to think, as we're going through these, I think it can be really clear and maybe obvious to everyone that taking a proactive approach would be best practice, right? So why don't we do it more? That's a question that we can kind of hold for ourselves and think about. It takes some planning to set time aside to plan, right? And it takes this sort of different active approach. So let's think about for ourselves, what would it take to do more proactive planning in the organization that we work in? So again, with a reactive approach, it's going to involve the most vocal stakeholders. It won't necessarily involve all stakeholders because likely there's been some group or some individual that's been harmed. That's why we're reacting, and it's their voice likely who will be heard the most. Not always. Sometimes it's the other way, the opposite of that voice, if you have like two opposing sides. But either way, you're less likely to hear from all concerned because you won't really have time to have collaboration in that same way.
Right.
Did you have something?
No, not right now.
And you also will usually only work then with one group's expectations or one stakeholders or one group of stakeholders. Yeah. And you're more likely to negatively impact people's sense of autonomy if we're operating from here.
So when we look at human behavior change, it's when you were saying we don't necessarily do the proactive thing, I think it's something we should all think about here, because one of the reasons is that it's not in our high importance level when it's not happening. Mm-hmm. So it does require us to really actively move in this direction to be proactive, because when it really happens, when something happens, that becomes hugely important, and we react to that right away. So if we can do this other piece, if we can find that way to help ourselves, maybe to say to ourselves, wow, you know, if we do this proactively, these things won't happen. These things will be better. The folks who come here will feel safer. So our environment will feel safer for everybody. Our ambiance will be different. So I think it's important just to understand that. It's not that we're bad people or that we don't care. It's just that it doesn't stand high in our importance level.
If I can jump in, we've heard from some of participants online. So some of the things that they're thinking about is having staff who are home-based and going to the community daily, and it's a changing environment that's hard to predict, and so physical safety changes daily, so it makes it challenging to make everyone feel safe. There's another comment from someone working in a psychiatric hospital, and that given some of the clients there, their behavior can be very unpredictable due to being paranoid or assaultive, that creates safety concerns, again, both for the other people who are there in the environment, both patients and staff. So I think people are thinking about this in multiple settings and really curious about how to acknowledge some of the real issues that face kind of the workplace environment, which could be anything from out in the community to an enclosed kind of locked type of facility, so a wide range of environments.
Sure. Absolutely. I'll just go around the inpatient psych unit for a moment, if you don't mind. If we want to look at the work that Maggie Bennington-Davis has done around inpatient psych units or inpatient unit around safety and using the sanctuary model, I think that we may see some things there. She was able to move the unit from multiple seclusions and restraints to none. So something happened in that environment. Something changed. The people were the same, the staff were there, the patients were there. Something changed in that environment. And I think there's another piece with this that's important. There's never going to be a time when everything is safe. There's never going to be a time when I could say to anybody, nothing bad will ever happen. It's more about how we think about it and how we prepare ourselves and what do we do minimally. If I'm a young woman at a party, for instance, and I'm becoming very intoxicated, I guess I'm not as safe. And what do I want to do about that? There's things to think about. When I do that community work, I do it quite often, going to people's homes. I don't walk out with my purse hanging out, shaking around and saying, oh, there's this old lady with her purse hanging out, and asking somebody to please come and take my purse. I think about it. I make myself as safe as I can be. And what I've really personally learned is how I speak to the people that I come across as I do my work is probably my best safety tool. How I speak to them and how I treat them.
So we want to be clear, just especially in light of recent events that have been high-profile cases. For instance, right, when we're saying that we want to maintain our own safety, that is in no way saying that other people's actions towards us, whether or not we're being safe for ourselves, are ever okay. Right. So we just want to put that out there in case we were, thinking about any current events that could be triggering.
That is the balance I'm talking about. Yeah. We can't ever have it 100% safe on this side, but there's things that we can do to enhance our safety, and it's that part we can do something about.
And you mentioned, that we'll never be able to make everyone feel safe, and I think that is really part of what we're getting at here as well. That first of all, people's interpretations of safety, there's as many, examples of feeling safe as there are people. So we can't make anyone feel safe. We can help everyone's voices to be heard around safety. And there are things that we can do to increase safety in our individual organizations. So someone mentioned inpatient. We also, and you had a response thinking about people who have done some research around that to increase safety. So even though we won't cover particular types of organizations and what specifically they can do, because it wouldn't be helpful for everyone to hear. We do know that if you drill down and start including all stakeholders, there's best practices there for almost every organization that's out there. And I'll just spend a second thinking about, if I'm working with I worked with a school district who, in one particular school, they were having teachers were having a lot of difficulty feeling safe. They were frequently engaged in students were attacking them frequently. They felt like they didn't have enough support of people coming to help them out, et cetera. So one of the things that we worked towards was having collaboration with all teachers, all administrators, and a student, some student panels and student representatives to say, what can we do to plan for when this happens because it's occurring? So there's different things that we can do to have collaborative practices involved and involve everyone.
Yeah, and then there's a difference when I'm saying we can't ever be safe. That's not really what I'm saying. What I'm saying is we can never guarantee that nothing will happen outside of us. Mm-hmm. We can up the ante for safety.
Yeah, so we just want to spend a moment here, Cheryl alluded to it already, thinking about, how does this relate to some of what we talked about last time? So we know we've got this stress response system. We get triggered in a part of our hypothalamus, and it sends out, and the pituitary gland and the hypothalamus talk to each other and send out some great responses to the adrenal glands to release some stress hormones, and we get this feedback loop that's very adaptive and really helpful when we're in danger. And it becomes maladaptive when it's triggered over and over again, and we have, later poor health outcomes, for instance, or thought processes that we find unhelpful in given situations. So just to keep in mind that these stress responses have an impact on our bodies, and they have an impact on our interpretations of safety. And if you are in fight, flight, freeze mode because of your body being triggered, it's very difficult for you to look at anything outside of the lens of safety. Yeah. So you're always kind of, you can think about safety literally as like these lenses. If you're only thinking about what's safe or unsafe because you're triggered in fight, flight, freeze, we can have a tough time thinking about anything other than our own safety.
Yeah, and to be fair to ourselves as human beings, it's our own fear of change and the risk to take to do anything different where we work. I mean, it feels there's always that piece of comfort that this is what we've always done, and what are we going to do about it? So somebody did ask about the sanctuary model that was used, and it was Maggie Bennington Davis, Dr. Maggie Bennington Davis, who did this, I believe, out in the West Coast. And of course, the sanctuary model belongs to my old brain, Sandra Bloom. Thank you very much.
So physical safety, just want to look at what our recommendations are, right? So there's not a hard and fast answer for every situation, right? So we tried to think of what are our general recommendations that we would give almost any organization or group of individuals who wanted to plan a little bit more around physical safety. So one of the main things would be making a process for reviewing your physical safety. So it might just not be something that you're considering unless a problem comes up. So creating a process that intentionally reviews what physical safety means for the people who are accessing it. So it should involve all stakeholders. You want to have everyone's voice heard. I can't remember who it was. I think it was a congresswoman, and her name's eluding me, who said if you're not at the table, you're probably on the menu, right? So we need everybody at the table, or they may really suffer for not being there. We need a process that considers everyone, so you may not always be able to get all stakeholder involvement, and even if you do, so having someone at the table is very different than considering them, right? So holding that all stakeholders are there and that they matter and are important.
And the folks that we might really have to consider are the very young and the very old who may not be able to have a voice at all. So what I would do for safety physically for somebody that's 1-year-old might be quite different than what we would do for an adult or what we would do for someone who's 90. And it's really important to think about those things.
Yeah. So you'd want this process to not necessarily plan for all, right? So it becomes really cumbersome to have proactive safety planning that involves planning for every possible iteration of what might happen. What you'd like to do is have some sense of what you would like to happen generally. So we know generally if X happens, we want Y to happen. And when we plan too tightly, we remove flexibility and creativity for problem solving in the moment. And we like people to have the culture of feeling safe so that they can really creatively problem solve when things come up.
Yeah, and we have to, one thing we've talked about before, Gwen, to remember is what one person finds makes them feel safer, somebody else may find makes them feel much less safe. And I
we'll
personally will, yeah, I'll wait for that.
So, and again, we would just recommend that this sort of planning occurs outside of a crisis. Now, I think it makes a lot of sense if it gets triggered by a crisis,
yeah.
right? So maybe you've had like 3 bad crises in the last week in your organization, and you think, you know what, it might be a great idea for us to start planning for ourselves what we want to do about these crises. So it might be that it gets triggered by it, but to not be planning in the midst of crisis.
Right.
So we wanted to just touch on an example of planning for physical safety, particularly if you're someone doing home visits, and I think some people in the chat had brought this up.
Yeah,
so
one of our guests on the chat had mentioned this, so we're very interested to hear what you're doing already and what's important to you in that.
Yeah, so offering, if you could chat in, if you are someone who has done in the past or currently does home visits, what are some of the ways that you provide for your own physical safety, or what are some of the strategies that you've used or your organization uses that work well? And Cheryl, I don't know if while we wait, you want to chime in with a couple, or you want to wait?
Things well. I chimed in with my purse, and
yeah,
yes, and I have time of the day that I prefer to go to. I prefer not to go in the evening if I'm able to go during the day, especially the earlier morning hours. I find that I feel somewhat safer in some of the neighborhoods that I'm in. Anything else? I think, you know, I'm gonna go back to what I said. I treat the person's place with respect. When I go there, that's their home, and I don't act in any way other than I'm a guest, and I really want to understand what they want me to do there, what they will have me, how they want me to behave. In other words, you know, if the shoes have to come off, the shoes have to come off. If somebody says, don't take your shoes off, this is my house, I don't want you to, I leave them on. It's simple things like that where I don't act like, you know, I'm kind of taking over. Really showing great respect for the fact that this is their place and I need to fit into their place while they're there, while I'm there.
Yeah, I love that tip. We were just talking about that while we were consulting on something last week. And I think Elizabeth has some folks that have chatted in to share.
Yeah, so a number of suggestions for people who are out there doing this work, going in pairs, at least initially, especially if it's the first time, making sure someone knows where you're going and when you're supposed to arrive and leave.
I did that this morning, Elizabeth. I told my partner where I was when I was at someone's house.
Let's see, being mindful of how you dress, kind of knowing the area, and I think those were some of the suggestions that people had. Let me just kind of see what else people have.
While you're doing that, Elizabeth, can I just ask you then if there's things that haven't been said that you are concerned about or still thinking about that you would like to talk about with this? You know, anything left that isn't being met by these things we've offered from the peers here.
Yeah, and even if you don't chat those in now, feel free to chat them in as we go on if something pops up for you. We'll certainly do our best to address it. So.
Some other suggestions are having your cell phone with you, also making sure your cell phone is charged, and just knowing the neighborhood that you're going in and being familiar with it, maybe doing a kind of a visit ahead of time to get more familiar with the neighborhood. Lots of good suggestions are coming in.
Great. Sounds like people really know what to do to keep themselves safe.
Yeah, that's great. Thank you. Anything else?
No, I'm good with that. Yeah.
So if we're thinking about psychological and emotional safety, we also had some recommendations to consider here. So holding, and we'll have more to say about some of these too, because they might not be so apparent, I think, as some of the physical safety recommendations are. So holding others accountable only for that which they have control. So especially maybe if you are a supervisor and you might be holding someone accountable for something that they don't have control over. So for instance, when I was doing complex care management for folks who had chronic illnesses, I might be held accountable for someone's HbA1c, which is a measure of how their diabetes is doing, essentially. I don't really have control over how someone cares for their diabetes, so it's tricky to be held accountable for something that you can't actually control. And it's something that we just see across systems frequently, and it's something to watch out for. We speak to this a lot.
Yeah, like I had mentioned about the doctor. The problem with that is that when people are feeling the anxiety and that stress again about having to meet some sort of outcome over which they have no control, they actually engage in behaviors that make it less likely to have the outcome happen. Because what we usually do is go to telling people what to do, and we all know that that doesn't really get us very far. So it's hugely important that we're able to see the difference between what we can control and what we can't. What you can hold your staff accountable for as a supervisor is their willingness to continually grow as a clinician, to learn more, to understand more, their curiosity, their desire to understand evidence-based practice. And I would say everyone who's on this webinar right now is someone who has that curiosity and just wants to be better at what they do. That we can hold people accountable for.
Yeah, and on that same token, accepting responsibility only for what we can control. So I might, in my example, accept full responsibility for how I'm communicating with a patient and making sure that I'm doing my best work that I can do with that individual, and really holding firm responsibility for that. Am I up to date on best communication practices for change, right? Am I up to date on all the information about diabetes in case they ask me questions? So it's things like that.
Do I take good care of myself so that I'm in a place? Because unless I feel safe and unless I know myself, it's going to be very difficult to help someone else feel safe.
So when someone's behavior doesn't match our preferences, cultivating curiosity. So this might sound, I don't know, a little vague maybe, but when I'm thinking about helping someone feel safe, what doesn't come to mind is labeling a lot of their behaviors, right? Overreacting, over the top, what are some other judgments?
That's all right, because I'm going to go to a little different place. I'm just going to say, I think the hardest thing for all of us is that we only have one perspective in life, and it's ours. And if we haven't got curiosity, we're really never going to be on point with anyone because we only have our perspective, and everybody's going to be different. Everybody's journey has been different.
Right, so if I'm thinking about labeling, so maybe someone has a reaction to something that's happening that seems to me to be an overreaction, right? Instead of labeling it as an overreaction, I might think about what's going on for this person, that it made sense to them to flip a table rather than talk to me about what was happening, right? So I can think about, it might seem like, so if I'm thinking about working in youth services where I frequently saw tables flipped, if I said, no, we don't have any more chocolate milk right now, and then someone flipped a table, I could label it overreaction, or I could ask myself, what's going on for this person, that seems like a good strategy to get their needs met, because our behaviors are, just strategies to get needs met. So asking what's going on for that person rather than doing the labeling.
Figuring out what the need is and how it can be met other ways. And the person themselves will be the one that will have to figure out that. How can it be met other ways?
Right. So we also want to think about, this is a tip about practicing generally in low-stakes situations. So it might not be your preference or your practice to go to a place of curiosity when you're in a challenging situation. It just takes a little bit of practice. And if we practice in lower-stakes situations when we don't have so much on the table to lose, it can be easier when stakes are higher to keep that curious and open mind. So understand that our interpretations of others affect how we respond, and they can help in escalating or de-escalating.
Absolutely. How we think about them will show in how we respond to that.
So we have these slides, and we're going to go a little bit quickly through the next couple because we have a role play that we want to get to that we think might be entertaining for you. So we touched on this a little bit. We think it's important to think about how we frequently feel responsible for outcomes that we don't have control. So thinking when we feel responsible for something and it isn't what we want, it can cause some stress. But we don't control other people's behaviors, so we can't control all outcomes. And we talk about this a lot, especially when we're talking about burnout and compassion fatigue, because there's a big chunk of that that can come from feeling really responsible for things that we can't control.
And there's that other thing about choice, too, if you don't mind me quickly, and I see you have that. You know, it's not recognizing or that we have the choice not to do things. We're not required to continue to give all the time without it being what we really want to be doing.
So we have choices in these situations where we might feel like we have responsibilities. So we can stay where we're at, right? We can keep being upset or stressed about things not turning out the way that we want. So I can keep getting upset and anxious about a person who has diabetes not having a lower HbA1c even though I told them to lower it, right? So I could stay in a really stressed out place about that. I could get out, I could choose another profession, I could say I'm not going to work with that patient anymore, you know, something like that. There's a number of ways to leave this situation. Yeah. Or I can change my framework and let go of the responsibility for the things that I can't actually control.
Yeah, boy, that sounds freeing.
Yeah. Sometimes it's easier said than done. Sometimes it just clicks and you realize that this is going on and you can make this change. We just think that acknowledging that you have these options when you're feeling stuck can help empower you. So just to know, I always have these three choices. And that then there are times maybe where we've said, I'm choosing one. I'm choosing to be really stressed out. But it can be empowering to know that's the place that we're in. So we're going to do a really brief role play. I'm looking at my partner here to let us both know that we need to keep it brief. We want to leave time for questions, and we have some more slides after this too. So we just want to give a little demo of an interaction so that you can contrast and compare a little bit. Yeah, I think that's all I'll say before you intro it.
So guys, don't tell Gwen. Listen, I come into this treatment center 3 times a week. And when I come in, they got that glassed-in desk, and these 3 women sit behind it, and they often don't even give me eye contact. They make me stand behind that HIPAA line. I think you probably all know that line. Well, I don't think they understand what this feels like to me. When I'm standing there and nobody pays attention to me, I'm thinking about, they don't like me. I'm not good enough for them. I feel bad. I mean, I come here for help, and I got to stand here and not feel good about myself at all. I hope today is better than it's been.
So for this, I'm going to be behind a window and having a busy day at this clinic. So, okay. Ma'am, you can come on up.
I've been waiting for 5 minutes.
Do you have your insurance card?
I just said I've been waiting for 5 minutes.
I know, the line's really long. Do you have your insurance card?
It happens every day.
Ma'am, if you're not ready, I'm going to see the person behind you. You can come on up.
I knew this would happen. I knew this would happen.
Lisa, can you just go ahead and call security? I've seen her before. Yeah. She always does this.
You know, folks, I'm going to tell you, the reason I haven't said what I felt about this for so long is because I knew one of 2 things was going to happen. They were either going to kick me out of the program or mental hygiene me. It happens every time. They do not understand what it feels like not to be paid attention to as if you're important to them.
So we're going to do another version of this, right, where I'm just as busy and we still have this glass between us, but show that it can go a different way. So typing. Ma'am, you can come on up now.
Oh, thank you. I've been waiting for 5 minutes.
I know, we're really booked. I'm sorry that you've had to wait this long.
Oh, I'm glad that you're recognizing that. Better today. This is the first time that anybody's asked me.
Oh, yeah. Well, we're glad you're here. I know that it's been a wait, and I know you've really struggled to get in here lately, so we're definitely happy to see you. I'm wondering if you brought your insurance card with you this time.
Yeah, I did, but no one has ever even recognized how hard it is for me to get here all the time.
I know that public transportation is really tough in this city. Yeah, and I know it frequently makes folks late, so I appreciate that you were able to make it here.
Oh, wow.
Yeah.
Thank you so much.
Yeah,
I'll get
of course.
you my card.
Great, thank you. Okay, so that interaction doesn't take any longer, right, than the other interaction. In fact, it's shorter because I don't have to call security in this interaction. So obviously, the first one is maybe like an over-the-top. We kind of were quickly getting to a crisis situation just so we could see how we can escalate things really quickly. I've certainly seen something very similar happen, though, in multiple settings, so it's not so far outside of the norm, unfortunately.
I didn't take that out of my head. That was somebody I worked with around trauma-informed care, a client receiving services, who told us when we were in a group that when she was waiting, and one day it was 10 minutes without anyone acknowledging her, that she was thinking all those trauma tapes in her head. I'm not good enough, I'm not worth it, why would anybody pay attention to me? And didn't have the assertiveness to go up because she was so frightened she'd go into her fight mode and end up being kicked out of treatment. And it was really very stressful for her. So in essence, she was being re-traumatized every day she went to treatment as she stood and waited.
Yeah. So we can't necessarily keep a clinic not busy, right? We can't make it so people can't stand behind a HIPAA line. There are all these things that we don't have control, but we do have control of our tone of voice, we have control of our words, we have control of our facial expressions and our interpretation. So those are the things that we really want to work on. I want to pause and see if there were things from the chat that were pretty relevant that you wanted to share.
Someone just commented in the first scenario, you just ignored her altogether. That ended up just reinforcing Cheryl's beliefs.
Yeah.
And the second scenario, that when you used your active listening skills, it led to a different outcome.
Yeah, it felt, I mean, I'm just pretending, and it felt so different for me. Of course, that'd take your conversation longer because I need to give you affirmations for treating me so well. Thank you. Yeah, but I've had people say to me, it felt like a conversation and not an appointment. And that's the difference I think we're looking for. It doesn't take time.
Yeah.
It's just a way of being.
Certainly. So there's probably lots more that we can unpack from that, and it might be helpful even to think about if role plays might be beneficial in the organization that you're working in. Cheryl mentioned you can actually physically feel a difference between doing something a trauma-informed way or not, or using these good communication skills or not, and sometimes it just helps, again, to practice in a low-stakes situation. So we wanted to just do a quick little environmental walkthrough. So this is something that we might do for folks if we're consulting with their organization. What are some of the ways that people might be feeling safe or unsafe? So I'm just going to throw some pictures up here and quickly go through kind of what we would be looking for.
Nice lighting there, Gwen.
So
I don't like that dark area, though, way back there behind.
Right, there's caution tape. And again, so we can't control everything about our physical environment, right? But we can be aware of what it might be like for people. So if I'm working in an organization where this is the parking lot, I may offer to folks, if you need an escort coming to and from the clinic, we could help you out. If you want to call us when you get here so we know how long to expect you before you get to the front, you know, things like that, ways to help hold people's safety despite your sketchy parking lot, right? And so you might not be able to do anything about that parking lot.
Good lighting.
Waiting area. Sorry, I'm laughing at this picture. So is the waiting area really cluttered? Is there a lot going on? Do people feel like it's confidential? Are they being acknowledged when they come in? Right. Yeah, this is obviously a very busy waiting area with tons going on that might be a sort of sensory overload for someone.
Yeah. You know, I just want to go back quickly to that thing with the desk, too. When you have a glassed-in desk, for instance, we know that it might be there to help prevent people from hearing conversations and holding HIPAA, but having that ability to go beyond that, to think, what does that feel like to a person coming in? Does it feel like a barrier that you don't want me over there? You're afraid to get close to me, that kind of thing. So I think that's really important. it can have a good purpose.
Mm-hmm.
And yet, on the other hand, for me, and we've talked about this, if I go to a place where people are going with guards and there's, you will go through the metal detector, for me, I feel more unsafe than if I walk in somewhere that seems welcoming and here you are. And yet I understand some of that, but everybody's reaction is going to be different. And
Absolutely.
That's the important part.
Right.
Just because it feels right for one might not for others.
Right, so Cheryl mentioned the reception desk area. So how you're greeted is huge, right? If you're being greeted when you come into the waiting room, that's wonderful, but that's frequently not the case and not how most places are set up. So the way that you're able to approach the desk, and you know, people working in reception are in a tough situation. They're charged with doing usually vast quantities of work while also interfacing with clients. So it's very difficult to negotiate this. So even if you can bring some level of transparency, it helps acknowledge folks' humanity. So even if you're like, I'm sorry that I'm looking really stressed out today, I'm really struggling to get all my work done, it's not about you, right? So right away, if you're able to say something like that to someone, it acknowledges that you're a human being and they're a human being, and maybe you're not at your best today, but you're trying.
The transparency is so important.
Right. So corridors, hallways, transition spaces, what does that look like when people are walking through your organization? Are there lots of places for people to kind of hide out, or that people might be worried that they, you know, not only that their physical self might be in danger, but that it doesn't seem very private, or it just seems cluttered and scattered and disorganized looking.
Right. That hall would not do well for the very old and the very young.
Right. And then what is your meeting space like? Is there room for people to feel comfortable? Is there only one spot for them to sit? And if so, is it, you know, on top of a clinic table? Are you engaging with them? Are you making eye contact with them when you're in that space, or is everything behind your laptop? If you do need to be on a laptop while you're meeting with someone, how are you negotiating that so that they know, you know, that eye contact is important and you also have this task to do? So again, having that transparency about sometimes what we're told we need to do to maintain our jobs, while also attending to what's really important to the people in front of us and to us as people.
Yeah, especially when we're gathering information, that people know that this is, you know, this isn't fun particularly, and you've probably been asked 5 times before, but this is something we need. And then maybe looking at processes to see if you can minimize some of that too.
Yeah.
It's worth the effort.
Yeah.
How could I get this information in a more friendly and engaging way?
Right. So, 12:54, I think we have time for a couple questions, if anyone has some or if some have popped up.
Yeah, we'll give people a moment. Just want to share some of the comments. Someone shared that when they got a new CEO that they were adamant about new paint and furniture, and she kind of thought that was not something maybe essential at first, but she commented that it really changed the atmosphere and has had a huge impact.
Right. When the environment is respectful, it really makes a difference to how you feel.
Yeah.
Let's just see if we have questions. I think you kind of covered this, but someone did have a question just about those physical barriers, your thoughts on like having the actual glass there.
And that's where I'm going to go back to it again. For some people, they may feel safer. For others, it may feel like something that's really in the way and difficult to deal with. This is the thing I think about safety that's so important, is it requires that proactive work when we're not in crisis to sit together as a team. And that team can involve the people we serve. And what does it feel like to you? And when we pull people together to make these decisions, we're more likely to get the kind of behavior and interaction and engagement that we're looking for. When people hear themselves saying, this is what I'd like to have when I go to my treatment center or whatever I'm doing, it has more power. It just makes a difference. And they're more likely to do it. So I just feel real strongly about that. We're not going to say one thing is right or one thing is wrong. It'll be right for some things, and maybe not right for somewhere else.
Yeah.
There was another question just about for staff, knowing that we can have our own trauma histories. How do we protect ourselves from things that might trigger us?
Yeah, wow. Thank you so much for saying that and for acknowledging it and having the courage to do that, because that is crucial to what we were talking about, understanding our own place and where we are and taking care of ourselves, and understanding what triggers us and what are we going to do. There's a place to be proactive again. If you know that, if you've had some safe place to talk about it, hopefully your supervisor or perhaps your own personal therapist, something like that, you're able to plan for these things ahead of time and know what you can and cannot do and how you can react. I think that's really, really important.
Yeah.
Isn't acknowledgement just a big part of that right off the bat? Recognizing what it is that is difficult for you.
Other questions?
No, I think you've answered.
Great, so we just want to leave a minute to review the CEU process in case you missed it in the beginning, and I'll turn it over to Elizabeth for that.
Yep, so you can just see the slide walks you through how you can obtain your CE credit. So after registering within 24 hours, you can log back onto the NYU Silver CE online portal, go to your registrations, next to your name of the webinar you attended, you'll see Take Assessment. Once you've completed the assessment, you'll be downloaded or directed on how to download your CE certificate. And you can see that for questions, you can contact silver.continuingeducation@nyu.edu for further help.
Great.
Okay. And here's our contact information. So if you have additional questions about, you know, the topic today or trauma-informed care in general, we are happy to receive those questions and have further conversation and dialogue with you.
So just want to thank you all for being with us today and going through this webinar. We've definitely enjoyed, you know, making this, and also enjoyed the comments and questions that came up. So thank you.
Thank you for your curiosity and your desire to understand this better and to take it back to the work that you do. Thank you.
So one reminder that there are 4 more sessions, right? Yes, 4 more sessions. So next month in July, we'll be covering trauma-informed collaboration, August, trauma-informed supervision, then building a resilient workforce and creating a path for resiliency. So we hope you're able to join us for those other webinars, and we'll look forward to seeing you again. Oh, and there are some other webinars and trainings through CTAP. So the things that matter, addressing the social determinants of health, really important webinar. Women and mental health, embracing the intersections of trauma, oppression, and agency, promoting nutrition education in diverse populations. So these all look fantastic. I'm going to be on some of them listening as well, so I hope you'll be there. All right, thanks again, and we hope you have a great rest of your week.
Thank you.